Hi, everyone. Today, I'm really excited to be kicking off our next partnership with Carbon Health, where we bring questions that you have from the community to different physicians in order to get those answers directly in the palm of your hand. And today, I'm really excited that we will be talking about influenza or the flu with Dr. Justin Young, who is the Regional Clinical Director for Southern California for Carbon Health, and who has 10 years of urgent and primary care experience. So it's great to have you, Justin. And if you could just give a little bit of information to the community on what the flu or influenza even is.
Got it. Thanks for having me. It's great to be here with you, Dr. Rob. Really exciting opportunity to kind of, connect with patients and just take the time to kind of talk through some of the things that, we deal with on a regular basis. So when it comes to the flu, most of you are probably familiar with influenza or the flu. And in the most basic sense, it's, the typical, cold that we deal with in the wintertime. But what makes this a little bit different is that seasonally, we all go through, from time to time, experience influenza as basically an upper respiratory or respiratory infection that's caused by a virus, influenza, and it can lead to mild symptoms of runny nose, cough, sore throat. But typically, when it really hits hard, it can lead to body aches, fevers, chills, a lot of discomfort, and really can kind of get people to stay home from school, stay home from work. So really can impact in a pretty significant way. The symptoms typically are mild, but in some cases it can be, harmful enough where we are experiencing or see patients that will experience complications from the flu, particularly if you have other medical conditions, certain patients with different respiratory problems, medical issues that can impact them and affect them as well. Patients that are, immunocompromised or dealing with other medical conditions, cancer patients in particular can, have some severe impact there. But I think one of the things that's really important to keep in mind is that, those patients who had a really rough time with, COVID infection over the last 2.5 years, influenza can hit them pretty hard as well each season going on. So we want to make sure that we're being proactive, being very mindful of the ways that influenza can impact us, but also just making sure that we're taking the steps to protect ourselves from the flu. And I think that's what we're probably going to dive into a little bit here with why we get flu vaccination and why people are always asking, why do I need to get a flu shot every year? Is this something I need to do? And the answer basically is yes. In most cases, it is important that we get our flu vaccine. So it's been interesting to see how the evolution of the flu has been over the last 2 years. In particular, as the pandemic has kind of raged and people have been wearing masks, I think we've noticed there had been a little bit of a decline, or at least a shortening of the flu season as a result of some of the steps that were taken to really prevent COVID. We can talk about it, dive into it a little bit more, and I'm here to answer any basic questions you might have.
Yeah, I think that was perfect. And it led perfectly into talking about the flu vaccine, because luckily, even though the influenza virus is one of many viruses that are out there, we do actually have a vaccine against this particular pathogen, which isn't true against all pathogens that we see. So
exactly,
we're in a good spot there, but there are a couple different types of vaccines. So before we kind of get into why someone should get it, can we kind of break down what the type of flu vaccines are that are on the market? So maybe touch on how they work, and then also that there's an age difference on sometimes someone who is under 65 can receive a certain type, but maybe over 65, there's a different type that they could get.
Your typical everyday, vaccine, there are a few types and a few varieties. I mean, you've got your typical, flu vaccine for patients that are typically like adult up to age 65. Mm-hmm. But when you go beyond and over age 65, typically you want a stronger or more potent vaccine there for older patients who might be at greater risk. But then you also think about pediatric patients who might not tolerate, a vaccine or getting an actual shot. And so there are also nasal versions of the flu vaccine, like FluMist, that also provides, that immunity and that protection. So There's just a range of options that are available for patients to consider. And also, there are certain patients, if they're allergic to certain components of the flu vaccine, that might not, consider getting vaccinated in this way. So there are other precautions and ways that you try to, be protective and prevent flu infection throughout the flu season. So those are things to kind of keep in mind and consider and to talk with your physician about.
Yeah, I think that's a great point. And, that most of these flu vaccines are typically protein-based, or they're inactivated forms of the influenza virus. And a lot of people kind of wondered, how does people predict, or how do scientists and medical professionals predict what the next strain is going to be the following year? Because that's always something that is a trick. We don't always know. But can you maybe throw in a bit of details on that topic?
Yeah, so I think in terms of how we predict and anticipate for when the next strain is coming, what's going to be the predominant strain each year, we try to base it off of historical information, and also to try to anticipate what waves of flu and strains of flu may have impacted certain areas of the year. Not every part of the world experiences winter at the same time, right? So that also gives us insight to when flu might peak. So as you commonly know, influenza itself, the flu season will kind of start roughly around the fall. So looking at September, October, you want to anticipate and start to think about getting vaccinated at that time. So when, those colder months start to kind of pick up, that's when you start to anticipate and get an idea of what wave and what strain and what type of flu is going to be more predominant. So one of the things you want to consider at that point is, we try to anticipate for the next year's strain. We're not at the point where technology is going to instantly create a vaccine for us. And then on top of it, while we might be able to kind of produce certain strains or certain types of vaccines, prepare them in a lab, we aren't able to mass produce that, to the quantity where we can get that out to the general public. So you kind of have to anticipate and plan early. And so when it comes down to it, sometimes people will say, oh, I got my flu shot last year, but I still got the flu. And it's well, maybe the vaccine missed the mark. And it's yeah, sometimes it may not, and it may not anticipate the specific strains that come about. But, one of the things to keep in mind, and I know it's something that we've talked about in terms of COVID, even though people have been vaccinated and can, then get the flu, or even when people are vaccinated and can still get COVID, the severity of illness is going to be much less with the vaccine. So even though you feel it may not anticipate, or even though you feel oh, well, I get the flu every year anyway, I'm not going to get the vaccine. What we call morbidity that's impacting, or the way and how bad it impacts you or affects you, is not going to be as severe with the vaccine. And so that's the importance for, reminding everyone why they should get the vaccine.
Yeah. And I think that hits on the moneymaker question. The top question that came in from everyone is, should I get the vaccine? A lot of people were saying, I'm healthy, or I've never got it before, and I don't know if I should get it. So, what's your take on if somebody came to you and they were I want to get the vaccine? What do you think?
My answer to that every year is yes. When patients come and ask, we always try to preempt that and say hey, have you gotten your flu vaccine yet? Definitely, think about that as we start to get to the end of the summer months. They're hey, we're getting the new, flu vaccine in. You might want to go ahead and set up an appointment with your primary doc, or just set up an appointment either at your nearby pharmacy. You could come to, Carbon Health, obviously, for the vaccine as well. But you want to anticipate and get ahead of the curve, because again, even if you're the type of person where you're I think I'm, healthy, getting a vaccine is preventive. It's to keep you healthy, and so to keep you from getting severe illness, keep you from getting that really bad flu that can come through and kind of knock you out for 5 to 7 days, those body aches, those chills. When you have the flu, you have the flu, so it's really important to kind of prevent that severe disease, that severe, flu infection, and keep you on the go. So even if you think that oh, my immune system is great, this is just a little bit of added protection to keep you on track and minimize the risk of, that kind of severe flu that a lot of people can encounter. That again, like I said, even though it's, can be relatively mild, it's not without risk, and people do die from the flu. So just want to be, put that out there, make sure that patients are aware that it's something that you got to look out for.
And as Justin mentioned earlier on, this is something that usually happens in the fall and into the winter. And that's when we have a lot of family holidays that are going on, or gatherings. Nobody wants to be sick during those times, and you want to be able to enjoy it. So having a little bit of an extra layer of protection does not hurt at all.
Yeah. And I think it's really important to kind of keep in mind too, it's that added layer of protection, not just for you, but for your family, and for those family members that might be, specifically sensitive and who might be a little bit sicker. Older patients can be at greater risk for the flu. Patients with other medical conditions, like I mentioned, could be at greater risk for the flu. And again, those patients that are allergic to components of the flu vaccine that might not be able to get vaccinated, those family members that you're gathering with during the holidays, you want to do it not just for you, you want to do it to help protect them as well. So those are important details to kind of keep in mind. And yet another reason why, if you're asking the question, why should I get the flu vaccine? That would be a reason to do so.
Yeah. And I know that we kind of began touching on the topic a little bit, but some audience members were curious about, they heard people comparing COVID to the flu. So is there any information that you can provide about that topic? Like, how are the two similar, but then also how are these two quite different?
Yeah. I mean, I think in the ways that you like think about it, both are kind of, pretty significant respiratory, viruses, right? And they create very similar respiratory illnesses. Obviously, COVID has been quite deadly. I mean, honestly, I'm trying to think of the way to best describe it, but COVID has been really incredibly impactful on the landscape lately when it comes to healthcare. It's really impacted every aspect of our lives over the last 2.5 years, and still doing so. And a great number of patients are still, dying from complications of and directly from COVID. So keeping that in mind, they're very similar in the ways that they impact our immune systems, the way that they impact as an upper respiratory or as a respiratory virus. They can create very similar symptoms. I think the inflammatory component of COVID is definitely more aggressive. I think the assault that COVID puts on the immune system is quite significant, and the long-term lasting effects and impacts, when you think about long COVID that we talk about, we're still studying and looking at the ways that COVID has that lasting effect. Thankfully, influenza doesn't affect us in that way with the long-term after effects, but still there's a certain degree of, illness and severity of disease that can really come from it. And so in that way, when we talk about getting vaccinated, there's a preventive component that's there when it comes to influenza, and also obviously the life-saving preventive, component when it comes to getting vaccinated for, against COVID as well. So in that way, as respiratory viruses and respiratory illnesses that they cause, they're very similar, but COVID, obviously magnitudes worse, magnitudes more severe than what you would think from common influenza each year.
That kind of shifts into this later part of this individual's question, wondering about the different vaccines. So we have COVID vaccines and we have flu vaccines. And I think it would be really cool if you could just give a brief description on what is the difference between the COVID vaccines that were initially launched, I think talking about those mRNA types, and what are the common types of flu vaccines, so typically protein-based.
Got it. So when you think about vaccines, really what vaccines do is that they kind of train our immune system, kind of like in Rocky. They train our immune system to be able to fight infection. So in this case, when you think about influenza, typically the ways that we've looked at impacting fighting flu, it's been through inactivated vaccines, or what we call live attenuated vaccines as well. And what it does is kind of looks at actual components of the actual virus itself. So we look at elements of the flu, the flu virus itself that we want to introduce safely to the immune system to be able to prevent infection and to identify when the real flu, virus is introduced to our body. Our immune system knows how to attack that and neutralize it. So similarly, in that way, when it came to the earlier forms of the COVID vaccines, particularly what we call mRNA vaccines, the technology there has been available for quite some time, but the technology that we've been utilizing in that component, and I know you've addressed this and talked to many times over, diagrammed, drawn this out, but to oversimplify it and make it easy to understand, what the mRNA vaccine does is that it creates and generates specific components of proteins that will also stimulate a response, an immune response. So it basically targets different components and different elements of the virus so that it recognizes, okay, when it shows up, this is what it looks like. That's how your body knows, okay, once COVID is on the scene, this component and this protein component that presents, the immune system will respond to, and like Rocky, knock it out. So that's the goal there, is that we're trying to make sure that we're introducing components of the virus so that when we are facing or confronted with the real virus or exposed to the real virus, our body knows how to respond in advance to neutralize it and eliminate it and hopefully prevent severe disease. I mean, I'm sure you have elaborate ways of explaining it, but when I try to break it down and make it simple for patients, that's the way that viruses work. It introduces and kind of teaches our immune system how to speak the language of that virus to eliminate it.
Yeah, I love that analogy. That's perfect. And that kind of leads into what some others were questioning on. We have been using flu shots for a long time now, and it seems like, every year we do have to continue to have this updated shot. So is there any type of new technology that's coming out related to flu vaccines where maybe we either don't have to get as many shots, or maybe it could be more universal. Do you know of anything that, that's coming through the pipelines related to that?
I mean, honestly, like, I think the technologies and the pace at which we've been, developing vaccines for like COVID, I think that technology will be, out there available for the flu at some point. I think one of the challenges there is like, trying to keep pace and identify and anticipate what elements and what components are going to be there. So for example, when you utilize that like comparison for COVID, people are now familiar with like the different strains that are out there of COVID and why we need COVID boosters, and similarly why we would need boosters for other types of viruses that are out there. So in a very similar way, that's what we're trying to chase when it comes to the flu each year, and why we try to like anticipate how to like modify our vaccines to match that and to meet that. So I think you see similar conversations about that and trying to anticipate for COVID as well. But I think the key piece here and why it's really important to make sure that you get vaccinated, the more collectively vaccinated and the more collectively protected we are in certain communities, and certainly if we can figure out ways to make sure that we are vaccinating like all corners of the planet, right? Like resources are available in certain areas in varying degrees. And so I think it's really important to kind of think about this as a community. I think you think about, public health, we think about local, cities, states, countries, availability for those resources for them to develop vaccines. But when we think about it, we really are a global community and we are interacting and traveling more. I mean, at the beginning of COVID, we kind of like shut things down. But really at this point, because of how we are such a global community and we interact with everyone, the more people we can get vaccinated, the more protected, we will be. To that point, because we haven't been as stringent about some vaccines as well, it's like why we also are starting to see resurgence of like measles in certain areas. I mean, we had an outbreak that shut down Disneyland at one point, and now you're having conversations about polio making a comeback. And I know you had conversations about that on, previous discussions too. So really, we have to start thinking more collectively about how we approach that. I think we need to start thinking collectively about how we apply resources to all corners of the globe, all countries, and really kind of unite together to figure out how we're going to combat these issues. Because I'm really concerned that with certain circumstances, changing in the just global landscape, I think certain issues when it comes to like, climate change and the limited resources that are available because of that, and certain things that are being unearthed because of the different cycles in the way that the world is going now, we may start to see the emergence of newer types of viruses and viruses that we were or thought that we had combated and dealt with will start to kind of like reemerge. So it's just really important. I know this is like a long-winded way of answering your question, but I really want to emphasize how important it is, again, not just for each of us who have access to, these vaccines and to this, medical technology, but how important it is for us to be mindful and think about others as well, particularly those who may not have access to those resources, or for those people who may not be able to, who might be allergic or more vulnerable to these types of vaccines. And so we have to be, cautious about that as well.
Yeah, I think that when you touched on the polio outbreak, for example, that piggybacked really well off the conversation we just had with Caesar, kind of talking about there are different types of polio vaccines. And somebody wondered, well, why did we make another type if something else worked just fine? And that kind of touches on your answer in the beginning about having different types of flu vaccines and having different types of COVID vaccines, because there is different infrastructure throughout the world and not everyone has access to the same type of supply chains or storage methods or even injection methods that we can administer drugs or vaccines. So having, a plethora of different tools in our tool belt is super important for targeting this, global equity. And also it's great to know that in the medical and in the scientific field, we are still innovating some of these technologies, even though we saw success in the past, but we're not stopping just because we saw that success. It further bolsters like everything is tested very rigorously and continuously in order to ensure that it's safe for people to get.
Yeah, absolutely. And again, like that technology has been there for forever. And It's not like we're, out here just like trying new things or testing new things on the general public. There's a lot of rigorous research that goes into all the steps and all the technology that goes into developing these vaccines. So it's really important to kind of keep that in mind as well.
So then this kind of leads into one of our last questions from the audience, looking at supplements and like micronutrients and how does that relate to flu? Because a lot of people had questions related to when the flu kind of starts coming around, they see ads for, oh, take this zinc supplement or take vitamin C. So what's your thoughts on those type of micronutrient supplements combating these type of infections?
Yeah, I mean, I think it's a great question. And a lot of times, patients want to take ownership of their health choices as well. Like they want to take that into their own hands. So I'm not opposed to, respective supplements, like thinking about vitamin C, zinc, vitamin D, that sort of thing. It's not a substitute for, vaccines. It's not a substitute for regular, wellness visits and annual physicals with your respective healthcare providers. But ultimately, it's part of the package. It's part of your toolkit to make sure that you are making healthy choices for yourself. So, regular exercise, well-balanced diet, regular checkups, and definitely making sure to stay on top of your regular medications. If you do have, diabetes or hypertension, make sure you're managing your medical conditions appropriately. And if you have any questions, definitely bring that up and ask, your healthcare provider during those visits. When you go in for a flu vaccine, bring it up, say, hey, I'm also taking these supplements. Do you think that would be a great idea? Or, are there any concerns there? So talking about the whole picture, I think is really important, and really engaging patients in that shared decision-making is really, really key. So yeah, if you wanted to take a little bit of zinc or flu season or during flu season, not opposed to it. But again, it's a part of the whole package of what's available in our, healthcare toolkit and the decisions that we make, for ourselves. So empowering a patient to do that, I think, is totally fine, especially if they're in discussion with their healthcare provider.
Bringing it back to the patient, I think, is a perfect way to conclude the conversation that we've had. So I want to thank Dr. Young for taking the time to discuss influenza with us all. And I'd love to give him an opportunity to let the audience members know where they could find him on socials in case people want to tune in, learn more about what he's doing.
Awesome. Thank you for the chat, Dr. Rob. This has been great. If you want to find me, you can find me at YoungDocJustin on Twitter and Instagram. And of course, find out more about us at Carbon Health. You can find us at Carbon Health on Twitter, on Instagram. I believe we also have a TikTok account, so you might see me pop up a little bit there too. But ultimately, seek us out. You can find us at www.carbonhealth.com and really, set up an appointment. You can download our Carbon Health app. And it's really a great way for us, especially in the communities where we are. It's a great way for you to connect with us on urgent care, primary care, and we also have virtual care available as well. So definitely connect, definitely reach out, and thanks for taking the time and chatting with me.
Absolutely. And since this was our discussion around flu, I just want to highlight again, make sure you go out and grab that flu shot. We are entering the winter, and one little thing I always like to say is flu before boo. So that's before Halloween. So that's coming up soon. If you can get your flu shot before then, you're usually good throughout the remainder of the cold months. So
I love that. I'm gonna have to use that one. Flu before boo.
Yeah.
Very, very nice. Yeah. And also, if you want to, come into Carbon Health, you can get your vaccine with us as well. So, thanks for having the conversation. I appreciate it.
Definitely. So I look forward to chatting with everyone again soon. And until our next conversation, we will be talking about breast cancer again with Dr. BCW. So until then, everyone continue to stay safe and be well. See ya. Bye.